Right, plans here to move beyond pandemic restrictions are taking visible shape amid broader vaccination coverage and slowing daily infections, as Soa mentioned. And for that, I have Yeon-seung joining me now in the studio. Yeon-seung, welcome.
Thank you for having me.
So let's start with the latest efforts to move out of the pandemic here on the local front.
Well, health authorities just announced today that they're holding a public hearing next Monday to discuss how to ease into social distancing measures while keeping the edge on the COVID-19 prevention front. This hearing is to discuss the details of the comprehensive plan that the health authorities are drafting up right now so that the nation can take gradual steps back to normal from November 1st. Authorities are expected to announce the specifics sometime this month.
While Soa has mentioned Thursday's COVID-19 figures, I understand you have something to add, Yeon-seung, about the transmission trend.
Right, I wanted to note something particularly standing out. It's the high proportion of Delta cases among local infections. So experts already projected months ago that the Delta strain was going to be the most dominant strain, not only nationwide, but also worldwide. But this is the first time that the nation has seen a total Delta takeover among local variant cases. Health authorities identified close to 3,250 variant cases among community infections last week, and 100% of them were Delta. The nation has also seen a climb in breakthrough cases as well. 1 out of 4 people who tested positive for COVID-19 in the first week of October were actually fully vaccinated individuals. In particular, Johnson & Johnson recipients in Korea saw one of the highest rates of breakthrough infections. It was 5 times the rate seen in Pfizer recipients and close to 40 times found among people jabbed with the Moderna vaccine.
Right, I see. Now, Yeon-seung, yesterday, that would be Wednesday, you spoke of the U.S. looking to grant the green light for booster shots for those who received the Janssen vaccine. I understand there's been an update on that front.
Right, so I just mentioned how breakthrough infections are more common among the Johnson & Johnson vaccine. So U.S. FDA actually authorized the booster shots on Johnson & Johnson vaccine recipients and also the Moderna shot recipients. What's different about the Johnson & Johnson shot, however, is that the recipients can get the booster just 2 months after their latest shot if they are aged 18 and over. For Moderna and Pfizer recipients, however, only people 65 or over or those who are considered high risk can get the shot. And it's recommended that they get a booster at least 6 months after their second dose. The agency is also allowing a mix and match approach where people can get a different type of jab from the one they originally had. This expands the U.S. booster campaign to include tens of millions more people and gives more flexibility to health services.
Right. Now, aside from the booster shots, Yeon-seung, I hear authorities in the U.S. are also looking to further promote or expand, that is, their public vaccination campaign.
Right, they're dropping the age of vaccinations significantly. So the Biden administration is currently preparing to vaccinate millions of children aged 5 to 11. U.S. officials on Wednesday outlined a plan for vaccinating children and said they've already acquired enough vaccines to go around roughly 28 million kids. Part of that plan involves inoculating children in pediatric offices to provide a more comfortable environment for the children when they get their jabs. Anthony Fauci, the nation's top infectious disease specialist, says this is a step that is critical in curbing the spread. The U.S. Centers for Disease Control and Prevention is expected to announce its decision sometime in November.